My next guest is Umaru Barry, a Sierra Leonean Guinean American. He was born in Sierra Leone, but his parents are originally from Guinea. He now lives in the United States for several years, where he has been studying medicine. He is a fifth-year doctor of medicine candidate at the University of Texas Southwestern Medical Center with a research focus in molecular microbiology and medical interest in international emergency medicine, global health, and infectious diseases. Before starting his studies at the University of Texas Southwestern Medical Center, Umaru Barry established several organizations that raised thousands of dollars for humanitarian relief, providing uninsured patients in New York City with health literacy programs, creating relief projects to support hurricane victims, delivering healthcare and medicines to underprivileged communities in the Dominican Republic, establishing pre-medical pipeline programs for underrepresented minorities, and organizing research projects geared towards HIV/AIDS and child mortality in Uganda. He aspires to be a prominent team member of the World Health Organization. In this interview, Umar talks about the COVID-19 pandemic in details and the preventative measures Africa and the rest of the world should take to avoid infection. Umar is very passionate about helping others. It was an honor to have interviewed him. Here he is, the determined Umar Barry on the Barry Media Show. Thank you, Umaru, for being on the Barry Media Show.
No problem. Thank you so much for having me.
Great. So the COVID-19 pandemic continues to march on, and Africa has not been spared. We hear a lot of cases of coronaviruses in different parts of Africa now.
Yes.
So far, more than 12,000 people have been affected, and over 500 or even thousands of deaths so far. So what do you say about that?
So I say, Africa was mostly spared in the beginning, and that's most likely due to the limited travel and the less travel from areas that were affected. But as time went on, just like other cases, for example, the United States was affected way later, started in March, really, end of February, March, and, places like Italy and others were started earlier. So now I think the next wave is the Africa wave. And this, we have to be very careful because, as you know, Africa's health infrastructure is not nearly as strong as many of these developed nations. So I think, also the other thing that we have to think about is the limited number of testing. So if you don't test, the numbers will be low, the numbers affected. So we have to also think about that. So I think it's a combination of a limited number of testing that are in Africa and the number of travelers that were from affected countries that reached the African continent. So those two made the numbers for Africa low. But there is evidence of community spread within African nations, and this is something that we have to take real care with right now. And these numbers, I think the latest numbers that I've seen were more than 50,000 cases. Even just places like Guinea currently have 1,700 by itself. So, and there's also one thing that we have to think about is, the changing environment. The seasons are about to change for many of these sub-Saharan African nations. So we have to think about that as well as it comes to the number of and the rising cases, the rising number of deaths for the African nations.
Let's talk about stigma a little bit. We know back in the days when HIV was prevalent, a lot of people died because they were afraid of social shaming. In your opinion, how best to mentally prepare African people that this is a malady, as a global pandemic like any other maladies? The sooner it is detected, the better it will be. how to help people come forward for more testing, or how to take away the shame of being a COVID-19 patient?
I think with everything, it starts with education. I think African nations are doing a good job with that, and I think one of the main thing that we can do is showcase the numbers, show how many people have recovered, and actually get people to interview people who have had COVID-19. Just like HIV, show people that this is a disease that people get, and it's totally normal to get diseases like this, and that's the first step, is knowing that this is a disease that that can affect everyone, and showing that this is a disease that we can also recover from, because most of the times is people or individuals feeling like this is a disease that cannot touch me, because since I'm young, this is not going to happen to me, or since I'm in Africa, this is not going to happen to me, or many of the stereotypes that we have seen, such as that Black people cannot get COVID-19, which was debunked, debunked clearly by Idris Elba, who is of Sierra Leone descent and is a Black person, having COVID-19, and he's famous. Another thing that this has shown is that anyone can get this. There's ministers of health. There's Boris Johnson, the Prime Minister of UK, who have had this disease. So it's showing that people in power, people who are not in power, anyone and everyone can get this, and then that will reduce the stigmatization and normalize the testing, showing that come get tested. Testing is important, just like with HIV. You get tested, then you know what to do for moving forward. If you don't get tested, you will not know, and knowing is power. I say knowledge is power.
How does that work? Like how does the coronavirus work in the body?
Okay, great question. So with the coronavirus, it affects mostly the lungs, and the way it does that is it causes two, I wouldn't say separate, but two distinct phases of illness. The first one is pneumonia. Many people have heard of pneumonia. It's caused by many different viruses and bacteria. So pneumonia is basically the lungs filling up with fluid and being inflamed. And when that happens is you don't have enough airspace. So think about your lungs as basically a sponge. For you to breathe, air needs to pass through freely and just go through, and then you capture the oxygen. So what happens is once it gets filled with fluids, that basically reduces the capacity of the lungs to take in oxygen. And so that's what happens in pneumonia, is that you get all of these different things that happen within, that limits the lungs from doing their job. And the second thing that happens with COVID-19 is that as the pneumonia progresses, you get something called acute respiratory distress syndrome. So basically, that's a form of lung failure, and when that happens, is basically you're unable to breathe, and that's why many countries are pushing for ventilators. Because if you get pneumonia, if it's severe enough, or if you get acute respiratory distress syndrome and it's severe enough, then you definitely need to be on a ventilator to support and get you to actually breathe properly. Because when the lungs are filled with fluid, it basically isn't able to expand as much, isn't able to bring in, because the lungs, the way they work is this: they expand, air comes in, and then they basically deflate, and then air goes out. So the ventilators do that for you. They expand out, bring in air, and then they deflate, bring in air out. So the ventilators do the same job as what your lungs will do.
Why is the disease being called COVID-19?
So with every single disease, there's the virus that causes it, and then there's a name that the World Health Organization gives it. So COVID-19 was given the name coronavirus disease 2019. It was discovered in 2019, and it's caused by the SARS-CoV-2 virus. So just like any other diseases, the virus, and then there's also the disease that it causes.
Why might someone avoid individuals and groups because of COVID-19?
So I think this is where all the all the social preventative measures come in, and why you keep hearing the word social distancing, and social distancing. So the virus is thought to spread from person to person, especially in confined areas. So, and they say that within about 6 feet. So when you are in groups or with other people, as you talk, as you breathe in air, as you touch other individuals, this is how the virus spreads. It spreads through respiratory droplets. And this is what happens when someone coughs, sneezes, and or talks. And this is important because it is also known that with COVID-19, you can spread it even if you're not symptomatic. Meaning, if you don't feel sick, you can still spread the disease, not knowing that you have the disease. So that's why they say avoid individuals or groups currently, because certain times you don't even know who have the disease versus who doesn't. And that's why they also tell you to wear masks, and they change the guidelines and say everyone wear a mask, because you do not know who has the disease or who's actually able to transmit the disease. So as I mentioned, it's spread through respiratory droplets. Basically, is when you cough, when you sneeze, when you talk. So when you do that, the virus is able to suspend in the air for quite a limited amount of time. And if you breathe in those things, or if you're able to touch those virus particles and you put it in your face, or put it in your eyes, or put it in your nose by touching your face, and so that's the way the virus spreads. Yes.
So can mosquitoes or ticks spread the virus?
So at this time, no, it hasn't been confirmed, or there hasn't been any evidence of this virus being spread by mosquitoes or ticks. Mostly is spread. The main way that COVID-19 spreads is through close contact from person to person. For the first thing to know is most people who get COVID-19 will be able to recover from home. So if you are taking care of someone at home who does have COVID-19, is it's recommended that you take different precautions to make sure that you don't get the disease as well. So if possible, basically make sure you put on a mask for yourself when you're taking care of that person who's sick, and using separate rooms and bathrooms for the sick versus not sick people avoids basically individuals coming in contact with each other, and washing your hands and making sure everything is clean, especially before eating or preparing food, or before and after going to the bathroom, and using soap readily, and also providing the sick individuals from your household with face masks. As I mentioned, this is spread from person to person through respiratory droplets. And if you do get sick, call emergency services if it is intense. But as I stated previously, most people who do get this disease are able to recover from home. So there's no need to be super alarmed about this. It is possible to recover from home. And also avoid sharing utensils or personal items between you and the person who is sick. And the incubation period for this is 14 days. So if from 2 to 14 days, after 14 days, they get better, then you know that person is not sick anymore, cannot transmit the disease. But it is tricky when, for individuals, for families that have a lot of individuals. I think the best thing to do is, take those other precautions, which is using hand sanitizer, washing your hands, and making sure things are very, very clean in the house and organized. And if you can, making sure you isolate the person who is sick or the people who are sick into that one room, and everyone else staying in the living room. That is very, very important. Or if you can, have some other people stay at other relatives' place until everyone else get better. But we know, that that's not always possible. So it may be important to, just do your best, especially with taking the other precautions. I believe that will reduce the likelihood that this does spread to the rest of the family members. So some of the things that you look for within the 2 to 14 days after being exposed to the virus is cough, shortness of breath, or difficulty breathing. And there's also other ones that are very non-specific, such as there's fever, chills, like muscle pain, headache, sore throat. And there's also one weird one, which is like you lose the sense of taste or smell. This has been documented in previous cases of COVID-19. So if you have any of these, or then it's important to just jot them down, especially the fever, the cough, the shortness of breath, because this may be COVID-19. But as you could tell, many other diseases also have these similar symptoms. So the only thing that can actually tell you if you do have COVID-19 is the COVID-19 tests. If you have had contact with someone who you know has had COVID-19, it's important. It's important that you quarantine yourself and continue assessing your symptoms and the symptoms that I recently mentioned. So if you know you've been in contact with someone who had it, you should stay home and stay away from others, and monitor the different symptoms that you may have. So taking your temperature and noting if you do cough or if you have shortness of breath, all of those things will let you know if you are developing the symptoms. But there's no need to be alarmed. Just stay calm and quarantine yourself. So after you recover and basically you don't have any more fever and you don't have any more cough and any other symptoms. After that, basically means your body has won against the virus. It means your body has cleared the virus, and now you have. This is more debatable if you have all immunity or just certain immunity. But after that, then you're unable to pass the disease to other people because you don't have the virus anymore.
There are people that say, I don't know, they say that warm weather can stop the outbreak of COVID-19. What is your opinion on that?
So currently we don't have like direct data that supports this. But one thing that we can say is looking at the wide spread of coronavirus. It's in places, Algeria, it's in South Africa, anywhere in between there. It's in Europe, China, it's in south of the US where it's like 90 degrees right now. It's in Louisiana. It's in all of these places who have way different. It's in Russia. So it's been documented in all different places throughout the world. So that shows us basically there's no really warmer temperatures will stop the outbreak because we see the outbreak in other places where there's warm temperatures. There's higher humidity, places in the tropical areas, Brazil. So there's no direct evidence that there's a temperature-based cutoff right now, and the number of cases show otherwise, because only vaccinations, fast-track vaccinations, actually right now can help us with this, alongside with finding proper treatments. So with vaccinations, I think right now it's been stated that it will take somewhere between 8 months to at least a year and a half to get a proper vaccinations. There are many vaccines within the pipeline right now, phase two clinical trials. And that's one thing we have to think about is we have to look at the safety of these vaccines, but we also have to make sure that they actually work. And so that's what the clinical trials will do.
Is there anything else you want to say before we end this interview, Umar?
I just want to say, especially with African nations, I think it is important for our governments and everyone, especially in power, to help with ramping up the testing. And as you mentioned, destigmatizing this COVID-19. It is important for everyone to know that COVID-19 is here, and we are able to fight it as we have seen in many different nations. And for African nations to use their strengths and come together and make sure that they take care of their populations. And especially as we have learned through Ebola and any other HIV and other infectious diseases in the past, it takes a lot of work from everyone to come together, whether it's education, treatments, diagnosis. Just a community has to come together to make sure we are taking care of, especially the most vulnerable populations within our countries. That's mainly it.
Great, great. Hey, thank you very much for a great interview, Omar.
Thank you so much for your time. I appreciate you.
Thanks to my guest, Umaru Barry. Thanks to you for listening. The Barry Media Show takes you places that you have never imagined. You can find me on Instagram at Barry Medias and on Twitter at Barry Medias. Please tune in next week for another great interview.